Hi dear colleagues, I'm Dr. Zeraatiannejaddavanai, attending professor of cardiovascular surgery and dean of faculty of heart and lung transplantation and organ procurement unit of Iran University of Medical Sciences and Healthcare Services, as well as advanced fellowship of thoracic organ transplantation in Chicago Northwestern University and Northwestern Memorial Medicine Department of Cardiothoracic and Thoracic Surgery, Canning Thoracic Institute. With my dear colleague Mr. Abolfazl Gholami, through our video series today I'm going to show how to harvest or procure successfully a patient with known case of the pulmonary thromboembolism. This is the third video that we are going to share in this respect with you. Accordingly, as you can see, this is the interstate heli board or jet board, organ procurement as well as transplantation, with including the lung as well as the LA cuff. In doing so, first of all, we go to the donor site, and after the confirmation of the brain death or the DCD of the patient, either type of the master classification, we perform the median sternotomy, inverted T-like precardiotomy, as well as assessment of the ascending aorta as well as the pulmonary artery PASP pressure not exceeding 25 mm mercury, which shows the either RV dysfunction or idiopathic pulmonary hypertension or secondary to interstitial lung disease or lung contusion which doesn't resolve. At the same time and simultaneously, we perform, as you can see within the previous videos, the fibropic bronchoscopy, including the right main bronchus as well as left main bronchus as all of the segmental branches, in order to impede and rule out the presence of any active infection with the concomitant pneumonitis or pneumonia, as well as sending for BAL, which is bronchoalveolar lavage, and the gram staining at the same time. And another issue to taking into consideration, the abnormal onset of the origin of the bronchus from, for example, the aberrant trachobronchial tree. After doing so, during this, with the appreciation to their specialist anesthesiologist, Dr. Nazafarin Kamalzadeh, who is really expert in the field of the organ donation and donation after cardiac death, as we have a video regarding this pulmonary thromboembolism. We are doing a recruitment maneuver in order to expand all of the lung and in order to impede any atelectasis in the presence of the pulmonary thromboembolism, which is harvest and which have the function or which can cause the primary graft dysfunction in the recipient lung. We open the pleural space, as you can see, simultaneously to assist the lung, and after the administration of the antegrade perfodex from the pulmonary artery to the first outline, during the harvest we are using the fluid catheter, as you can see, according to the sequence of about 500 milliliter of the perfodex solution with concomitant versatile vascular electrophysiology as a result of the stimulation of nitric oxide synthetase or synthase in order to vascular resistance. We can evacuate all of the clots from the pulmonary artery retrograde and use this lung which previously was discarded. So right now, with this technique, we can harvest the lungs with the pulmonary thromboembolism and no discarding, and as a result of doing this in other cases, we showed that the successful transplantation despite the presence of the pulmonary thromboembolism is successful. Another novel technique that we in the Northwestern University and University use with conduct of Dr. Mohar, the head of the department, which is ethical for lung perfusion device technique for the borderline donors. We use the immediately the harvest of lung as well as the cuff of the LA in order to anastomose the return of the blood from the pulmonary vein as well as antegrade flow via the CPB roller or centrifugal pump into the pulmonary artery, and this complete circuit circulations preserve the heart and lung in a lung in fridge technique. I really appreciate for paying attention to this interstate transfer.